The views and opinions expressed by the host do not necessarily state or reflect those of the company and its management. Furthermore, the views and opinions of the guest do not reflect those of the host, the show, the management, and the network.
Pause that listen. Sama-sama sa TLC.
Good evening, everyone. This is another Saturday night, and it was really a journey. What has the journey? What has been for us dito po sa Talk Live channel, because this is our first year anniversary po this month. No, we started during pandemic, and then until now we are still here with you. So please like and share our episode this evening. So this is at the second Saturday, isang we will be talking about our elderly, our senior citizens. Ang ganda talaga ng topic tonight. And what is exciting tonight, because our guest doctor is giving away prizes. No, may mga trivia tayo for this evening. So, please, no? Kaya lang po, I'm sorry po sa hindi taga Davao. Kasi po, yung mga prices po kasi we have to pick it up sa kanyang clinic. So dito lang po muna. Pero yung isa po, no? So I will show you first the prices for tonight sa ating trivia. Okay? Yung ganda talaga. So yun po, no? Pero ang book, sabi ni doktora, ay kahit saang dako ng Pilipinas, wag lang sa ibang bansa. So you can always get the book. So she will explain further about the book. Okay? So tonight is another night. So maganda ang topic natin this evening. This is really about dementia and other degenerative diseases. So we will explain. Doctora will explain this one further. Okay, so our guest not this evening is Dr. Eva Aranas-Angel, and I would like to share with you her previous position. She was the Pulso, the official yearbook of Davao Medical School Foundation College of Medicine, 1992, an editor-in-chief, no? And then a chief fellow of geriatric medicine at St. Luke Medical Center and chief president, Davao Doctors Hospital, and a volunteer trainer. So imagine our guest really has its advocacy of care for the elderly program, Vincentian Missionary Social Development Foundation, Group 3, Payatas B, Quezon City, Urban Poor Areas in Mindanao, and a coordinator of field testing of the handbook for assessment and malnutrition and vulnerability of older persons in developing countries, especially in Asia, Help Age International London School of Hygiene and Tropical Medicine. So ladies and gentlemen, mga kapatid, mga taga Davao, please like and share our episode tonight. I would like to welcome the very beautiful Dr. Eva Angel Aranas. Ang
Baliktad na naman
baliktad
mo.
na sa ako. Gusto ko ginisa ko si attorney. So,
Si Ted.
Eva Aranas Angel. Belated happy birthday, attorney. Okay, Doc. So, good
Thank you
evening.
for having me again. Good evening to
Wow.
our watchers and to those who are going to watch. Okay, remind we're already on air. Thank you so much again, Laura, for this Saturday with you. It's always
Wow.
an honor. Thank you.
So, before we will continue, Doki, grabe sabi ni Ate Aida, reunion of the election kasi. Nandito si
Family
Ate
yan eh.
Aida. Hi, hello Sonia, and Cora is watching.
We've always been family naman.
Yeah.
So
And
that's
then
why.
we have ah, sino pa bang taga-election? Sino po itong si ano,
Mirasol.
Dok? Yeah,
Nandiyan si
si Antonio
Mirasol.
oh yeah, Antonio Moran po.
Si Tony, yes, of course.
Ah,
He watched last episode.
wow. And then we have Mirasol. Yan. Hello, thank you for watching mga kapatid, mga kapuso, mga
Taway
imagine,
dapig-dapig
no?
jud ni
Sa
ba?
walay dapig-dapig, grabe ang suporta. Okay,
Thank you
sige.
for your support.
Sige, Doc.
Election
I
family.
will I will throw first the first question, no? So,
Okay.
hindi ko nakita. Nandito si ano, si Coach Edelor. Yan, meron pa pala, Doc. Sabi kasi mahirap na. So si Ma'am Madeline is
Madeline, yeah.
Madeline. So I always mispronounce her name. So,
Yeah.
and then
Hello. Good
we
evening.
do have also blessed evening po sa inyong lahat, si Coach Edelor. Hi, Coach Edelor. Share sa mga kasamahan mo sa simbahan, Coach, because we do have a very beautiful topic tonight. Okay? Sige, I will throw the first question for everyone. So you will win a one kit, no, yung mga pang ano, pang sa para talaga sa pandemic, no?
They call
So
it protection kit,
yeah,
part of
tawag
their
niyan.
advocacy. Oo,
Yeah.
for the yung minimum public health safety practices. So yung hand washing, disinfection, wearing of mask. Yan. And then,
Okay, sige. So I will ask the first question, Doktora. So what was our topic last Saturday? Sige, type in your answer and sino yung makauna? Si Doktor ako titingin. So what was our topic last Saturday? Okay? Sige, you will win a protection kit. Only from Davao, no? So we do have Cora, we do have si Mama Deline po, Doc.
they're from Davao.
Yeah,
They're
from
from
Davao. Okay, wow. Sige, Doctor, I am really very curious about this dementia and this terminology about Alzheimer's, degenerative diseases. Oh, si Mama Deline po ang unang nanalo. So,
Ano
aging
sabi?
gracefully. Aging
Yes.
gracefully. Wow,
You know, that,
congratulations po.
pwede mo mapakita yung kit natin. It comes with a bag.
Okay, sandali ha. Kasi ma-out tayo, hindi ko kasi na ano,
Wag na
sandali.
lang. Sige,
Okay.
mag-thank you na lang kay Ate Leah. Thank you for
Ah,
giving us the prizes tonight. Kasi hindi galing sa akin yan. Kay
so
Ate
si
Leah.
Mama si Mama Deline ang nanalo.
Oo.
Okay, thank you ma'am. So, alam niya ang clinic niyo po, Doktora?
Of
Or
course.
so you claim your prize po daw sa clinic ni Doktora Mama Deline. Okay. So what are these terms po, Doktora?
Anong gusto mong
Age.
term? Kasi marami.
Yung kaya nga yung
Puro letter
dementia,
D.
yeah,
Oo.
yeah, actually the 4Ds ng topic natin ngayon, no, dementia and other degenerative diseases. But I just want to be clarified first. What is this uh dementia and Alzheimer's hindi ko but
Okay.
I am yeah, I just want to know more about that, and maybe our viewers also. What's the
Yeah.
difference of those terminologies? Kasi
Okay.
yun talaga
Thank you
mga
for
familiar sa amin.
thank
Sige,
you
Doc.
for asking that question. No, you are asking me the definition of dementia.
Yes.
So, yan ba ang tanong mo, Lore? So,
Yes
that's your
po, Doc.
question. Yeah. You know what? I've been lecturing on dementia since August 19, and
Mm.
Zoom meeting. So, I've reached as far as Zamboanga, Cagayan de Oro, and Cagayan Valley. And because there have been a lot of interest about
Mm.
dementia. But if I say dementia, this is a very broad term which usually
Hmm.
comprises of memory impairment, behavioral problems, and functional decline. Pero pag sabihin kong ganon, medyo mahirap siya tandaan, ano? So,
Opo.
gawin na lang natin siyang formula para pang quiz natin, pang
Mm.
prizes natin sa next episode. So, dementia is equal to, para siyang formula, is equal to A plus B plus C. So, dun sa C, that's your cognitive impairment. So, when you say
Hmm.
cognitive impairment, laging kasama dyan yung memory. And most of the time, memory, lalo na pag Alzheimer's type, the memory nung nakaraan, yung sobrang lumang panahon, is likely to be intact. But the recent memory, those things that happened a few minutes ago, things that happened a few days ago, you don't remember. And that's for the spectrum of memory. Kasi yung sa dementia na memory loss should be severe enough to the point where it can get in the way with your daily practice. So if you're an
Hmm.
executive and you set a meeting and you don't show up, that's a different kind of memory loss than losing your keys or realizing that you were looking for your glasses and yet they're just on top of your head. So that's a different kind of memory loss. So it's so severe that even you don't realize it, but other people will call your attention or your family's attention. So, sir,
Oh.
ma'am, baka may diferensya na si dad mo kasi nag-meeting kami. siya lang wala, pero siya ang nag-set ng meeting. Or hindi na ho niya nababalanse yung book or ledger. So that's
Ala.
something unusual. That's the spectrum of memory loss na kinakailangan natin. Hindi yung, ano nga yung pangalan mo? Nagkita na tayo nung 1 week ago. Hindi yung mga ganon.
Mm.
These are very little things. Like even I, because of a lot of things that I do forget
Mm.
some things, but I make the effort to
To
memorize
remember
or
it.
um, write things down. Actually, I do write things down, and I don't and make it a point not to get upset. Medyo OC ako.
Mm.
I make it a point na I won't get upset if not all of the things in my list will not be realized. So that's one. So yung B is behavioral. So ang
Mm.
concept kasi ng society natin noon, pag nag-uulyanin na, is that um, limtanon lang, no? But they fail to recognize that behavior is part of it. And most of the time, it's anteceded by a couple of months or years by something that might be depressive
Mm.
and yet may or may not have some stressor. So, for example, you have a child who migrated to New Zealand or who migrated to Australia, and
Oo.
namimiss mo siya after a few months. Ayun, very rapid na yung decline ng iyong memory. So there are those who are showing depressive symptoms, not major depression, just symptoms ng pagiging malungkutin. They are isolating themselves. They're not joining their usual barkada anymore. They've
Mm.
lost interest in what they used to love doing. For example,
Oo.
ballroom dancing. They've stopped
Mm.
doing it. It's a red flag. And in my
Oh.
practice, it takes about siguro mga couple of years na nandyan na yan. Sasabihin ko sila, in retrospect po, mga siguro 3 or 4 na taon na ito, hindi nyo lang muna recognize. So, yun yung sa behavior. Actually, yung sa behavior, napakahaba ng listahan ng behavioral problems. But the early ones,
Mm.
aside dun sa sinabi ko na isolation and withdrawal and depressive symptoms, kasama doon yung accusation, because you misplace objects, di ba? Kasi malilimutin
Oo.
ka, makalimutan mo kung saan mo nalagay. Tapos,
Oo.
you won't remember where you actually placed those things, and you think that they were misplaced. But in a different spectrum, and in a more extreme spectrum, aabot ka dun sa punto na there will be accusations of theft, na parang ninakaw. So,
Ah,
if
talaga?
your household has a parade of kasambahay, na sasabihin
Mm.
na, ma'am, tabagan na lang ko pangit. Call me pangit, call me ugly, call me, call me
Whatever.
uneducated, call me an idiot, but please don't call me a thief, no? Huwag mong
Mm.
tawagin magnanakaw. Something like that, na ganun yung sentiment. Because yung accusation of theft is part of the so-called BPSD. So, yun yung hindi masyadong nare-realize ng mga tao, no? Sa dementia, may behavioral component pala. Ang nakasanayan lang, memory. So, the behavioral
Memory.
component can really be very stressful. And that's one of the reasons why the patient is brought to me. Aside from the stressful behavioral problems, nandiyan din yung problems with sleep or nocturnal awakening. Like they parang tulog manok, they call it. No, they wake you up
Mm.
in the middle of the night and demanding to have their breakfast, and then it's only 1 o'clock. Parang ganon. So they've lost
Ah,
the day and night cycle. And then, of course,
yes.
when I said A, earlier I said its function. So the very bare minimum function is what we are talking about, and that is personal care. And that would include bathing, dressing, feeding, mobility or yung paglakad mo or transfer. And at the same time, if you can hold your urine or not, na, yung continence. But a higher level kasi, ano siya, nag-overlap siya with what we call as IADL or instrumental activities of daily living. Because even if I have a patient with dementia, mag-isa lang siyang pumupunta sa clinic. So,
Talaga?
yeah,
Hmm.
yeah, they can find their way. Of course, treated na, no? Some of them.
Mm.
So,
Yeah.
we call them IADL. So your ability to, call a friend through a phone, your ability to do groceries, to manage your finances, still go to the bank to withdraw. That is part of IADL. So it means higher functioning. So pag bumaba yun, all of a sudden you can no longer do bank transactions, then it's also a red flag. Now, I am describing dementia in general. So you asked me kasi if
Mm.
what is dementia and what is Alzheimer's.
Yes
So
po, Doc. Oh.
I will summarize. So yung lahat ng sinabi ko nasa dementia kahit anong klase except that
Mm.
may variants, no?
Mm.
So halimbawa when I say Alzheimer's dementia, ibig sabihin is primary degenerative type na Alzheimer's. So, halimbawa, you have a pie, a pizza pie, okay? So
Mm.
it has a lot of slices, 8 slices
Yes.
ata. So about 60% of them, of the dementias will be Alzheimer's. So siguro out of the 8, 4 to 5 of those patients will be Alzheimer's. And there are other kinds of dementia. So, yung interplay or a mixed type wherein you are old and at the same time you develop strokes from before because you're diabetic, you're
Mm.
hypertensive. So, and there are strokes in strategic areas. So, aging process, degenerative process, plus the injury caused by the stroke, then it's mixed dementia. And vascular dementia, I usually see among younger patients. So,
Oh. So
yeah,
may
it's a bit
vascular
sad.
dementia pa din, no?
Meron. Because these are patients who may have like one time, big stroke. And
Mm.
it affects areas that have to do with memory. So, sasabihin mo yung mga temporal lobe, may mga ganon. But ang pinaka which is verified by neuroimaging, yung tinatawag na medial temporal lobe. Kasi yung kapitbahay nun is the hippocampus, which we call as our memory bank. So, may
Hmm.
vascular dementia. Kaya siya nakikita sa mga mas bata because these are patients who have diabetes that are poorly controlled. So alam naman natin na you don't need to have yung alam natin pag stroke, kailangan mataas ang BP, ano? But actually, you don't need to have elevated blood pressure to develop stroke. If you have poorly controlled and outrageous levels of your sugar, you can have a stroke. But the
Ah,
stroke
hindi
has,
na sa
but the
sugar
stroke
din
has
pala
in
yun, Doc?
strategic, yeah.
Hmm.
Kasi parang
Ah, ak
ginagawa niyang
I was really I was
sobrang
imagining
malabo.
that, yeah, ang stroke is just the cause of the high, yung mataas ang BP. So,
No,
ano pa din pala, maso-stroke pala din ang isang tao if grabe talaga mataas ang sugar
sugar.
level.
Yeah, yeah.
Oh,
And
I
then of
imagine.
course, you have also an interplay with elevated blood pressure. And
Mm.
some people kasi have this notion na pag ganito na yung edad mo, okay na yun ng ganung BP. Kasi ganun na yung edad mo. So, halimbawa, noon, nung walang pandemic, may umiikot na nakaputi, di ba? Tapos dala-dala nila yung, dala-dala nila yung kanilang pangkuha ng BP sa
Oo,
palengke. Babayad ng
oo,
20 pesos or 5 pesos.
oo.
Tapos, may narinig akong, namalengke ako noon eh. Tapos, may narinig ako na isang tindera nagpakuha ng BP. Tapos, tinanong yung edad. Edad ng tindera, mga almost 70. So,
Mm.
sinabi naman nung, hindi ko alam kung ano yung qualification ng kumukuha ng BP. Sabi niya, 140 over 90, tama lang na, sakto ra na sa imong edad. Para sa amin, that's already stage 2 hypertension. So, sana ho,
Hmm.
wag masyadong magpapaniwala po sa sa hindi naman natin kabisado yung qualification po.
Talaga namang sa
So,
doktor talaga tayo no, yung may kasi ang minsan
sana,
nga sabi
pero
nga,
alam mo, ang
parang
dami pa
sabi
rin
nga parang MD murag doktor sa Bisaya
parang
pa dok.
doktor. Maraming ganyan. Kasi
Mm.
mag-Google muna yan sila bago sila pupunta sa'yo. Di ba?
Yan. So, ngayon lang talaga ako na-clarify, no, akala ko yung dementia is dementia lang taga ano pala talaga siya, no,
Maraming klase. Meron pang
marami pala siyang
frontotemporal lobe dementia. Ito yung nakakalungkot kasi ang bata ng
mm,
pasyente, tapos napakabilis. In 2-3 years, gulay na. And they don't respond to the usual anti-dementia drugs that we give. And then you have the
hmm,
dementia, Lewy body type, para siyang Parkinsonian. Ang presentation, very prominent yung visual hallucinations. And then pag may Parkinson's disease, excuse me, pag may Parkinson's disease ka rin, alam mo,
mm.
pwede ka rin mag-develop ng dementia at the latter part of your Parkinson's.
So now
So,
I've learned, Doc,
marami.
na ang Alzheimer pala is part of
It's a
one
kind of
factor, is a
dementia.
kay dementia. Akala ko kasi minsan sabi nila na, ana na siya Alzheimer, ana. So diretso.
It's the kind of
Oo.
dementia na pag nagpagawa ka ng neuroimaging, for example, we have very powerful MRIs in the city, no? I
Wow,
think 3 hospitals have 1.5 Tesla, San Pedro,
mm,
Tavo Doctors, and Lanang Premier. So, they
mm,
have 1.5 Tesla. Dati, yung mga pasyente ko, pumupunta pa ng St. Luke's just to have the 1.5 Tesla. Ngayon, tatlo
mm,
na yung pagpipilian yun, no? But, the neuroimaging kasi, nakakatulong siya kasi papakita niya na there's no evidence of stroke. There's no evidence of a tumor. So, in other words, you have an 80-something-year-old patient. Usually, pag Alzheimer's, older sila eh. So, ang sasabihin
ah,
lang nun, global cortical atrophy or cerebral atrophy. Kumbaga, nanguluntoy lang yung brain ng pasyente. So, ang lagi kong
mm,
ginagamit na metaphor or lagi kong ginagamit na parang analogy, no? Yung sasabihin ko na halimbawa ho, pag bata pa or normal yung brain, parang siya, parang fresh na isang pirasong grapes. Pero pag
mm,
nagkaroon na po ng Alzheimer's, because of all the changes in the proteins, of all the changes that come with aging,
mm,
nagiging parang pasas na po siya. So yung pasas, di ba, the raisins. So,
mm.
kumpara mo dun sa fresh na fruit, of course, you don't expect either one of them to function the same way. So, lugi yung di ba, pasas. Kasi hindi na masyadong, halos wala na. Parang sa Bisaya, parang tilukon na lang nimo ang kanyang ability, or it's like
Ability.
scraping the bottom of the barrel. Parang gano'n na parang kung ano man pwede kong matilok dito na function ni lola or lolo. Parang gano'n.
Imagine, no? So it's very informative. Doc, we shall have a break, no? So that you can also, para baka kasi medyo, alam ko you have a
A
heavy
very
day
long day.
today. Very long day kasi marang lecture. So
I
we shall
started
have a short
early
break and
also.
we will come back for a short while.
Okay, thank you.
Mabuhay! Are you, your friends, or your family are still planning to come to Australia? Why not? Let's make it happen. And of course, you might be wondering about the visas that would suit you best. So this is the right time. Please tune in every Friday from the 1st of October, 5 p.m. Philippines time or 7 p.m. Melbourne time. So wherever you are, please adjust. So once again, let's talk about migration. It's great to migrate. Only here with Lee on Talk Live channel. So see you then. Let's talk. Bye!
Magandang araw po mga ka-TLC. Inaanyayahan ko po kayo dito po sa bagong show na gagawin po dito sa TLC, Instant Hotel Ed. Magsisimula po ito sa Oktubre 16, alas 5 hanggang alas 6. Lunes, Miyerkules at Sabado. Tatalakayin ko po rito kung ano po ba ang business industry. Tatalakayin ko rin po rito at magbibigay din po ako ng mga suggestion and idea kung paano po makakakuha ng trabaho sa business hotel industry. At dito rin po magbibigay po ako ng free employment idea doon po sa mga gustong sumakay ng barko all over the world. At dito rin po, ibibigay kong libreng-libre ang free cooking show para po dun sa mga ina na gusto pong makapagluto ng yummy food at healthy food para po sa inyong mga kids. Ito po muli, ang inyong Coach Ed na nagsasabing, minsan lang po ang buhay, gawin po natin makulay, huwag na po nating dagdagan ang mga problema natin sa araw-araw na buhay natin sa mundong ito. Hanggang sa muli po, sama-sama sa TLC.
Ayan, we're back, no? So grabe, akala ko talaga na yung ang dementia and Alzheimer ay pareho lang. So ang dementia pala ay ang Alzheimer pala is part of dementia. And Doc was sharing to us yung ano yung tawag nito yung sa cognitive, sa behavioral and functional aspects talaga yan ang mga we have to be very mindful of what is going on with our sa matatanda natin or even sa ating sarili, no? So I will ask Doctora again, no, to join us. Hello, Doc. So good evening once again.
Hi,
So
I'm back.
so ano lang muna, Doc, I will parang may ano kasi may bisita ka from Australia, from Zamboanga.
Oh,
Milagros Gerson po. Hello po,
oh,
Ma'am Milagros. Thank
oh,
you.
that's the mom of Madeline. Hello, mom. Good
Wow.
evening. Thanks for tuning in. Hello
Yeah.
po.
And we do have a friend of ours, no? Si Lee Montajes. Good evening, Ate Loretta Juarez and everyone. So she's based now in Australia. Sa kanya yung programa ang Migration.
Oh,
So
hi.
ito, yeah.
Hello.
So may programa
I
kaming
heard you have a
migration,
very great
yeah.
show. Oo.
Yeah, and then may programa din kaming on hotelet, no, yung mga ano gusto yung magtatrabaho sa hotel, yung si Doc, yung nagsimula siya kaninang hapon at 5 o'clock. So Doc, so now I've learned so many things na iba talaga. Akala ko kasi ang equals ang Alzheimer's dementia kasi. So thank you very much. So what
Actually,
are
you're not
yeah.
alone, War. Siguro
Mm,
50% of my patients who came in to see me for Alzheimer's or for some sort of dementia have that
mm.
notion also. So sana through
Ah,
this medium, I can make them understand that Alzheimer's is a kind of dementia. Pero yung mga nabanggit ko
mm.
earlier, they
Oo.
are actually the types of dementia that are irreversible. Hindi na halos natin maibabalik. No? Maybe we can delay the progression,
Mm.
especially if we can stop the showers of stroke, or we
Mm.
can control very well the risk factors like the blood sugar, the cholesterol, the blood pressure. Hindi na mauulit yung stroke, and maybe things will be better. But there are others, like for example, we don't usually call them dementia. It's an interplay of dementia and delirium kasi ang kanilang presentation is almost the same. For
Mm.
example, you have very low sodium levels. Nung nakaraang panahon kasi, the belief was that pag marami kang pag kumakain ka ng sobrang maalat, that will cause your hypertension, diba? So,
Oo.
the the caveat or the advice of most older doctors would be, wag na ho kayong maglagay ng asin
Uy,
sa pagkain nyo. And I still have patients like those. No? Sabi ko, ay ma'am, nagbabago naman ho kasi yung advisory. Hindi na ho kami
mm.
nagsasabi ng uh, wag no salt diet. What we have is no added salt. So, ibig sabihin, maglagay ka ng asin, pero pag naasinan mo na, natimplahan mo na yung salt to taste, which is about 4 grams of salt as against 2 grams yung low salt diet, and
Mm.
0 naman yung no salt diet, no? So, kung natimplahan mo na siya, sakto na yung alat niya, huwag mo nang palanguyin sa toyo, huwag mo nang palanguyin sa bagoong. Ganun naman tayong Pilipino, ang alat-alat na nga eh. Di ba? So, sinasabihan ko, ang ano lang naman ho, ma'am, ang natatakot lang naman po talaga sa asin, yung mga aswang lang, di ba? So, huwag na lang kayo, hindi naman kayo aswang. So, maglagay ho kayo ng asin. Oo. So, but just enough na magkaroon ng lasa yung pagkain. Para naman kasi punishment yung pakainin ka na walang asin, di ba? Parang,
Yan ang advice sa akin ni Doktora
ano,
Yorlin ngayon, Doc. Low
di
salt
ba?
diet.
No
Walang
salt,
walang
no added salt.
continue, no added
Oo.
salt. So continue lang yung hypertensive medicine ko, pero
Oo.
no added salt.
No
So
added
walang
salt.
ibang siyang ibinigay sa
Yeah,
akin.
that's the way we do
Oo.
things. Oo.
So we have Sir Andy Matula.
Oh, he's
Ayan.
back.
Oh, he's back. Hi, Sir Andy. And then we have
Good
Doc Arwin.
evening.
Sige. So we do have, thank you Doc for watching. So the second question natin Doc. So kanina sabi ko ang theme natin last Saturday. So ngayon ano yung first A? No, so as we look at aging gracefully. So please type in your answer dyan sa chat box. So ano yung A na una na diniscuss ni Doc last
Ano
Saturday? Yan.
mapapanalunan yan, Lors? Kasi ikaw ang
Yung
game
ano pa din
master.
yung
Yung kit pa
sa tingin
rin.
mo yung kit kasi
Okay.
4 yun, 'di ba? So nanalo na si
Tatlo
Mama
lang.
Del 3. So sige. So
But we
nanalo
have
na si
three
Mama
votes.
Del
So,
yeah. So nanalo na si Mama Deline. So may ano pa, may dalawa pa. So ano yung just give me the meaning of 1A na sabi ni Doc na we have to what? No, so
are they
that we
typing
can
in their answers?
yeah. No, not yet, Doc. So sige, we
Okay.
continue while waiting for their answer. So sabi mo, Doc, dementia kasi ang theme mo sabi sa amin is dementia and other degenerative uh, diseases. So
Listen.
what
Oo.
about these degenerative diseases po, Doc?
Okay. Ito lang po yung gusto kong takeaway message for tonight. Whenever
Mm-mm.
you hear the word degenerative, almost always it is age-related. So, ano nga ba ang karamihan or dahilan kung bakit pumupunta sa akin yung pasyente? Number one is pain. No? Doc, sakit ng tuhod ko or ang sakit ng likod ko. Yung mga ganon. So,
Mm-mm.
degenerative and then magpapa-x-ray ka, sasabihin na hypertrophic or degenerative osteoarthropathy. Basta pag may narinig kang degenerative, age-related ka agad yan. May kalabutan sa edad. May kinalaman sa edad mo. It has something to do with your age. So, if you are someone who has
Mm-mm.
those readings but you are not old, then maybe it's got to do with how you were using the joint, like what I did, like I overtrained or I overused
Yeah.
my knee joints. So katulad ng older patients ko na nagluluto ng latik at saka yung ano ba yung biko, yung basta may gata
Mm-mm.
tapos iniikot-ikot sa malaking kawali, biko.
Oo. Oo,
Tapos
Biko.
nagsusupply sila sa canteen. Ang
Mm-mm.
unang ang unang nireklamo siyempre yung kanyang, shoulder joint. Kasi nga yun yung gamit na joint. And I
Mm-mm.
also have overweight patients who are complaining of low back pain. And that's
Um,
because LBP, low back pain naman ang
I
tawag.
really need
So,
to bring my mother to you, Doc, kasi yan ang niya palaging complain.
yeah, kasi
Baka nga
the
nag-overweight si mama,
lower
'no?
back is the
Mm.
one that carries the entire weight of your upper body. So this one degenerative disease. And osteoporosis is degenerative. Minsan, nagkaka-interchange or nagkakamali yung iba sa pag-interpret. Akala nila ang osteoporosis at osteoarthritis ay pareho. Hindi po sila pareho. Kasi yung osteoarthritis, when you hear the word arth, no? Bone, so it's always a joint. So, yung rheuma, it has something to do with the joint. Samantalang yung
Hmm.
osteoporosis naman, di ba nakakakita kayo ng sample sa TV siguro or kung ano mang
Mm.
medium na pinapakita nila na yung buto na compact, na talagang matibay na buto, para siyang
Oo.
yung buto ng bulalo, parang ganon. So, ganun yung compact bone. Samantalang ang buto ng osteoporotic, parang nginat-ngat na or it's been made less porous kasi nagkaroon ng pagbabago sa microarchitecture ng buto dahil nangawala na nga yung kanyang calcium deposits or calcium matrix.
Ah.
So, ang nangyayari, Puwede niyong imaginin yung ano, yung lufa na panghilod, yung patola, 'di
Oo,
ba? Yung
oo,
kanyang
oo.
structural ano, ang kanyang structural, design, parang very porous, masyadong, yung maraming butas-butas na siguro isang gano'n mo lang, matumpag na siya or, it will crumble. So, gano'n din yung sa ano, sa osteoporosis in older patients.
Ay,
Osteoporosis is difficult in the sense na ano siya, tahimik siya. You don't go to the doctor and say, "Dok, sakit ng osteoporosis ko." You can't say that eh. Unang-una, kailangan mo ng tinatawag na bone densitometry scan. So, ang gagawin niya, ime-measure niya yung volume ng iyong bone. So, may mga numbers kami. Tapos siguro kung
ah,
pagpagawa na kayo ng bone densitometry scan, or sometimes we call it as DEXA, may
mm.
mga kulay yung results eh. So, pag normal, green. 'Di ba? Tapos, pag medyo ano na, yung osteopenic, yung sa yellow,
Ako
papuntang
ganyan ako, Dok, yung nandun ako
osteopenia.
sa
Oo. So,
oo.
nagsisimula ng
Hmm,
mabawasan yung calcium deposits mo. And most of the
ah,
time, it happens after menopause. Every day we
kaya pala.
lose, oo, after, every day we actually lose a lot of calcium, but it's accelerated during menopause. Kaya if you notice, most of the adverts for high calcium milk, low fat, or calcium supplements are directed towards postmenopausal women or even much, much younger women. So that when the time comes that you lose a lot of your calcium, hindi ka masyadong mabilis maubusan or hindi ka mabilis mag-osteoporosis. But nothing beats a more objective examination than the bone densitometry scan. Meron siyang specific value, no? Alam mo
Mm.
naman, pag negative value, yung t-value, cut-off niya is negative 2.5. Just in case may ano kayo, may result kayo na dun sa mga ano, minsan nagpapagawa yung mga nung pre-pandemic, and I'm not sure kung mayroong ganun ngayon. Yung sa ano lang, yung sa kamay, at saka
Mm.
minsan sa paa.
Paa.
Tapos, oo, bibigyan ka ng result. Tapos, oh ma'am, punta kayo sa doktor nyo. Kasi nga, papa-interpret. So, pag nandun ka na sa dilaw or sa yellow zone, then that's your osteopenia. And then, if you go to the red zone, nakatungtong ka na sa um, osteoporotic na spectrum. Ang ano lang, may sinasabi lang sila na ang kadalasan ng fracture, pag ang edad mo ay nasa 60s, and pag natumba ka or dahil hindi masyadong maganda yung balance, ang mangyayari, para siyang ano, you try to cushion your fall. So, yung nagkakaroon ng fracture yung wrist,
Oo.
we call it the Colles fracture. Tapos yung mga 75 and above or something ang edad, they have problems with their spine, vertebral spine. Yun yung nagkakaroon ng problema sa osteoporosis. Kaya kung minsan, nakakarinig or nakakabasa kayo ng X-ray result na compression fracture. Sa atin naman, pag nakabasa tayo ng fracture, parang may nabasag or may nabali. So, hindi lahat ng fracture ay may nabasag o may nabali. So, yung compression fracture, if you can imagine na lang, yung vertebral spine natin, it's like different layers of cake, di ba? So, layer siya, tapos nahugno siya. And sometimes, naiipit niya yung nerve, kasi may dumadaan
Mm.
na nerve dun sa tabi. So, yun yung dahilan kung bakit yung osteoporosis na pagbibintangan na reason for the pain. But actually, it's a it's a confluence of events. So you have an osteoporosis, you had a snap in your back, kasi nga osteoporotic ka pala, tapos karga-karga ka pa ng bata or ng baby. Tapos, pag, pag-ipo mo, tapos pag
Cellphone.
akyat mo naman ulit, di naghugno na yung yung spine. So may naipit, and then that's the cause of the pain. Now,
Ah.
it's different from the pain from arthritis, because most of the time the arthritic pains, you give pain relievers, you give, or you do some warm compresses na, yung mga ganon. But with the neuropath, yung ano, yung pain ng compression fracture, most of the time is
Mm.
called compression, neuropathic pain, kasi may naipit nga na nerve doon. So that's different. Yung mga
Susunod.
maaga nag-surgical menopause, or yung naaga tinanggalan ng matris, o kaya
Oo.
yung nagtabso, so in their 30s or 40s, they develop osteoporosis early. Ito na lang, yung patient na candidate for osteoporosis are the very payat, very lean, or very skinny older patients.
Okay.
And that's because, when you make your estrogen, yun yung kasi yung nawawala, di ba, pag
Sa
pag
atin,
nag-menopause
oo.
tayo, oo. But the mother molecule, or the parent ingredient of estrogen, is actually a form of cholesterol. So that if you're so
Ah.
payat, wala kang madaginot, or wala kang
Mm.
magamit na estrogen. So patients who are a bit on the heavy side are not
Mm.
so likely to develop osteoporosis, because somehow they have their cholesterol deposits na pwedeng i-convert, no? Very unusual sources of estrogen formation may naiiwan even if you don't have your ovaries anymore, but may ganong klaseng estrogen production, but very little, no?
So
So
talaga Dok, sa mga babae talaga ang ano niya 'no, ang usual
ay,
ano
wag,
talaga.
di bale,
Oo.
gaganti tayo sa mga lalaki mamaya. Baka may
Mamaya,
gusto
sige. Dok,
magtanong.
may
Oo.
nanalo na tayo, Dok.
Ay,
Si
sino?
Imelda, a friend of mine, but she's in Malalag, but I can
I'll
send
give
it
it
to
to her
her, 'no?
mom. I'll
No,
give it to
sige.
her
Ano,
mom.
it's
Si
Imelda
Mrs.
Rebuyon.
Rebuyon.
Ay,
Si Imelda, di ba
yeah.
works? Di ba Imelda works
Oh,
si DILG?
yeah.
She's
Kaya
one of
nga
my
pala.
favorite, she's one of my favorite bantay. Kasi she always brings her mom, and even if
Oo.
uh, she's very busy, tapos she brings her mom, lagi siya nakangiti. Parang
Yeah.
masaya siya na she's able to do this for her mom. Parang
She
ganon.
She's my classmate in college po, Doc.
Okay.
Oo.
So, way
And
dapig-dapig,
then,
no?
so ay dapig-dapig.
Pag
Si
next,
Doc
next
Arwin,
consult ni ma'am.
yeah, si Doc Arwin sabi niya Alzheimer's, ano kaya ang ibig sabihin ni Doc? Kasi sabi kanina Doc na medyo nahuli po si Doc, no? Na
Sige.
yun baka yun din ang concern niya yung para sa kagaya sa akin. And then sabi niya
Para sa
paki-repeat ang
sarili niya.
question. Paki-repeat ang question. Yun na po Doc ay yung first na ano po na ano yung aging aging gracefully, nawawala na ako. So, yun may naka-answer na po Doc. So ngayon Doc yung second. So
Oo.
second na A. So ang una is last
Kung
Saturday
ayaw
is
ni,
we
hindi
have
ba mabibigay kay Imelda yon? Kasi
so
outside of
mabibigay
Davao.
pero mabigay natin yung Doc. I can give it to her Doc.
Oo.
Basta bigyan natin 'yan. And then ang ipangalawa po, so what is the second one? So acceptance, the other two. So you just give me the other two kasi tatlo lang ang ating ano tawag ngayon yung protection kit na ibibigay ni
Number 2,
doktora.
di ba? Ang gusto mo.
Ah,
Number 2 or
ah, number two, what's number two? What's another A, no? Acceptance and then let another A of we age gracefully. So baka kung alam niyo ang answer, you just type in your answer in our chat box. So okay lang po ba ang aming sounds? So I believe they can hear us, no? And then we have another one po, Doktora, si Micaela Denise Susara. Is she your friend po?
Hi, Micah!
Yan.
Oo.
Hala, it's
Ang galing ko namang
9:34.
mag-recruit ng friends.
Yeah. It's 9:34 in the evening. Maybe we can
The night
continue
is
we can
young and so are we.
yeah. Yeah, we can extend for a while. So hello po watching si Coach Ed. Sa kanya po kanina yung ano, yung tawag nito yung hotelet na program. So thank
Hello,
you for
Coach
watching.
Ed.
Coach Ed. So talaga. So sino
Lord, ano na lang?
makaka-answer no? What's the
May
other
nag-answer
A?
na ba? Hmm.
Kanina si Imelda po, Doc,
Di ba si
acceptance. So pero
Madeline?
dalawa na nga pala ano,
Oo.
tama. So
Ay,
isa na lang.
Lore, meron
Pero
akong
'pag
memory
'pag
clinic,
maka-answer si
Lore.
yeah,
Lore.
no problem po. Pero 'pag maka-answer si Doc Arwin, yung book niyo po ang ibibigay natin sa kanya
Okay,
kasi we
okay.
can deliver it to him, 'no? Doc, ano yung pangatlo pala, yung ano Doc, second na ano, na acceptance, yung we age gracefully. So ano yung isang factor po na talagang gagawin natin so that we can ano, we can accept and then what is the other day? Oh, sino po yung nandito ngayon sa atin? Watching live, no? You can type in your answer. So, yun talaga, Doc. So, sabi ko, akala ko mga babae lang ang osteoporosis. So, ano tayo? We will, ano, with the men. Ano po ang other side of it sa mga
Um,
lalaki? Kasi
Ewan ko,
sa,
baka
alam
may
ko,
gustong magtanong. Pero
mm,
most of the time, para siyang yung sa prostate, uh, nagkakaroon
ah,
ng benign prostatic enlargement or hypertrophy. So,
mm,
these patients would develop yung parang di nila nakokontrol yung ihi o kaya paulit-ulit na UTI. So, may mga gagawin naman, may mga pwedeng management dyan. So, for some strange reason, hanggang ngayon, hindi naman nila ma-explain kung bakit lumalaki yung prostate. At now they're starting to monitor at the age of 40. So, si Doc ba,
oo,
pwede na? Oo, at the age of 40. So, um, usually, well, I used to do rectal exams, no, to check prostate size, but I felt that it'd be very awkward for a woman doing
yeah,
that. So
yeah.
I would rather just refer them or request for a transrectal ultrasound. Kasi, di ba, merong ultrasound na yung dinadaan sa tiyan, yung
Oo,
may nilalagay ng gel yung tiyan. Ang tawag kasi doon is
mm,
transabdominal.
oo,
Pero,
Doc.
pag gusto mo talaga ng something more precise na makikita, there will be a visual, no? Makikita mo yung itsura ng prostate. Makikita mo kung giring-giring ba siya or ano ba siya, kung smooth ba siya o kaya hindi siya smooth or magaspang or if it's rock hard or it is kumbaga may mga calcifications or may mga erosions. Nakikita mo yan. So, pwedeng may tinatawag tayong ultrasound guided also na biopsy kung
Mm,
in case sasabihin nila na ganito yung itsura, suspicious, it's way more than just a prostate enlargement. So, ang gagawin, they will do a biopsy. Pero, bihira naman yon. Ang problem lang ng ibang patients about having an enlarged prostate is, of course, urinary frequency. Kuminsan daw nakakaya pag sumasakay sila ng bus. Kasi, di ba may
oo,
pit stop? So, dapat
oo,
doon lang sila bababa, doon sila magla-lunch. And then after that, bathroom break. Pero mga ano pa lang daw, mga 100 meters pa lang daw, bababa na, maghahanap na ng kasagingan para mag-ihi.
oo,
So, nakakaya daw yung ganon. And meron naman tayong solution dyan, no? The management, pwedeng medical, kasi may nagpapalit ng prostate na gamot, or the management can also be surgical, depende kung ano yung napag-usapan ninyo ng surgeon.
mm,
Most of the time, very large prostates I refer to especially with uh, a correlation with an elevated PSA. So yung PSA is a tumor marker for prostate cancer. We will discuss this. So
mm.
I think on the last episode,
Last
no?
last
No.
episode,
Ay,
yeah.
nalungkot na ako sa last episode. Ano yun preventive gerontology, no?
Yeah.
Prevention. Like
So sa babae,
monitoring your
Doc,
markers,
sa
yung mga
babae, Doc, yung
markers.
osteoporosis niya, then yung ano na din, yung sa mga lalaki, ito din sa prostate problem nila talaga.
Prostate.
Oo.
Oo. At saka kung ano pa yung gusto niya aminin.
Mm.
Marami naman pwede aminin. Oo.
Oh, wala pang nag-answer for ano, for the second ano, ano parang dapat na gagawin 'no, so that we can age gracefully. So, thank you for watching also for my husband 'no, Joel Juarez is watching with us, Doc, okay?
Hi,
Sige,
Lord,
ano
makita mo ba if my husband is watching?
hindi ko nga makikita, Doc. Ewan ko, medyo may problema ata tayo sa ating mga
Ay,
ano.
pwede ko na lang siya
Oh.
i-greet.
Yeah, great. Yeah, happy birthday, belated happy birthday,
Love,
attorney.
belated happy birthday, 60.
Ah, ay, oo
Matanda
nga.
ka na.
And
Na-joke.
Cora is watching, Doc.
Hi, Cor.
She will be celebrating her 60th birthday also this
Oh,
coming Tuesday. Hello, Manang. Salamat sa
congratulations sa
pag
iyong dual citizenship.
Kaya nga sabi ko,
Filipino and senior citizen.
citizen. Sabi ko sa kanya, we went to
Ibagayway ang inyong
yeah,
senior
nag-advance
citizens
yeah,
card.
nag-advance greeting kami ni Joel sa kanya last night. So sabi ko, kaedad mo na pala si Attorney Cor. Oh, ayan. So baka may mga question kayo kasi we almost done, no? So siguro, Doc, kung may mga kulang pa tayo tonight kasi ang bilis talaga ng oras,
Ang
ano,
bilis
it's
ng
9.
oras.
Yung kaya
Ang
nga,
bilis ng oras. Parang,
yeah, parang ano
ang dami
lang,
ko
no?
namang na-discuss.
Marami na, Doc. So, it's 9:40. So that you can answer our, ano, tawag ito, may mga questions pa kami next Saturday. So you can replay, you can listen to Doktora again, and then be engaging next Saturday po. So, kung wala na po kayong mga questions, ano, if you have ano, clarification with Doktora, paki-repeat lang po, Doc, kasi may Alzheimer na sinabi si Doc Arwin. Sabi mo, yung baka
Ang
parehong
tanong,
concern kami. Alzheimer's lang po ang sabi niya. Ano kaya itong ano niya?
Doc,
Baka itong,
Doc Arwin, yung Alzheimer's, isang klase ng dementia wherein you have to
mm,
fulfill the following ingredients, no? Andun yung memory loss, severe memory loss, and then behavioral problems. Yung behavioral problems, hindi ko pa na-exponular, ha? Meron ka
oo.
pang paranoid delusions, meron kang hallucinations, usually visual. Dito natatakot ang mga paryente. Kasi,
Ah.
ang visual
Doc, we can
hallucinations
extend to
nila,
parang excited dyan, parang excited.
and then,
Ay, parang ano, informative masyado yan.
yeah,
Oh,
this is
sige.
important. I still believe this is important because this is an often omitted component of Alzheimer's. So you have your behavioral and psychological symptoms of dementia na uh, gawin ko na lang siya ganyan ko siyang maiksi. So
Sige,
yung
Doc.
paranoia, yung paranoid delusional disorders or yung accusations of theft na sobrang takot nila na baka yung kanilang mga gamit nakawin, they resort to hoarding. So yung kanilang kwarto puno na ng mga gamit na hoard nila. May isa kong pasyente, yung kanyang freezer puro hamon ng ilang taon na narigalo ng kanyang mga anak. Kasi baka nga daw nakawin. No?
Talaga?
Oo. So may mga ganong extent. May isang patient na pati lahat ng kanyang tools nasa ilalim ng kama. At pa yung mga herramienta, no, tools.
Mm-mm.
Tapos merong hallucination. So, part siya ng psychotic manifestation. So, ito yung dapat tandaan when you have hallucinations in Alzheimer's. It's always visual. So, when you say always visual, may nakikita ka. So, yung pag sinabi mong may nakikita, most of the time, sige, pwedeng sabihin nila na palabasin mo yung aso, wala ka namang aso, no? Or, bakit nandyan yung bata, nakasilip sa bintana, wala namang bata. But madalas, pero ang pinakamadalas is usually the dead people. Like their parents or their friends, they're long dead. Or yung mga contemporaries ng kanilang parents, no? Mga ninong-ninang, and mga lola. And this is the time na talagang natuturete yung mga family members. Nagtitirik ng kandila or nagpapamisa at sinasabi na, ay, si Lola, basin kuhaon na naman. Parang sinusundo na si Lola. But
Yan
actually,
po. Usually,
it is
ano
very,
yan, that's our very cultural Filipino.
that's very Filipino. But actually, that's just a part of the clinical spectrum of Alzheimer's na madalas, hallucinations or visual. And bakit yung mga dead people? Because these were the people they interacted with and they are familiar with when the activity and all the connections in their brains were intact. So yun yung parang na-deposit yung mga information na yon. And when you try to recall, yun yung mga lumalabas. So, they appear in the dreams, or kung may information ka na gusto mo i-retrieve during the war, maalala mo yun. But what you ate for breakfast, hindi mo maalala. So, another one would be the depressive symptoms. So, may mga panahon na um, sasabihin ng mga anak na, bakit niya kumakain eh, parang gano'n. Sasabihin ko na that's part of the depressive symptom. About 30% of patients with Alzheimer's na untreated or poorly managed or undetected have depressive symptoms. Merong extreme, ha? Yung disinhibition, I get to see about 10% of them. So, sexual disinhibition. So, there are those who masturbate. There are those who are there's hyper sexuality, no? Yung kinakalabit pati yung mga labandera, kaya nga wala tumatagal na or nagpapa oo. So only about 10%, but this is enough to warrant concern sa mga family members kasi nga nawawalan na sila ng kasambahay, or kaya they're afraid about they find the behavior shameful. I don't usually tell them to stop the older person from doing that. I just tell them to at least give them privacy. Kasi may iba sa sala. So, nakikita ng madla. Or some are undressing, they go up about the place, tapos walang top o kaya walang bottom. And this is because of lack of insight. So, that's also disinhibition. So, yung mga ganun.
So, Doc, yung Doc, kasi si Mama, ayaw niya ayaw niyang repeated food.
May mga ganun.
Oo.
Ayaw niya.
Ayaw niya yung...
Ayaw niya lang ng leftovers. Kasi iba yung sa akin. Yung ibang patients ko, longganisa buong taon. Tapos kaya palabok buong 3 times a day. Yung may may fixation about something. Minsan I don't know, baka may mga kakilala din kaya na patients with Alzheimer's, gusto nila yun ang isusuot nila. Kahit, Mom, you already wore that twice, no? So, this is my favorite. So, kahit mapanghina, susuot pa rin. So, ang ginagawa nila, bumibili sila ng siguro 7, 1 na yun na design. Kaya, palaging fresh. Kasi they're, the issue in Alzheimer's is routine. So, if you have broken routine, medyo parang yung world nila. Parang tumatumbling yung world nila. So,
si Mama, ayaw lang ni Mama ng repeated food. Kasi hindi niya maubos-ubos, no? Tapos, gusto niya, iba na naman. 81 po.
Red flag. Red flag.
Talaga, Doc? Sabi ni Imelda, Doc, ang ganda talaga ng niya. Thank you for the generosity of sharing your expertise, Dr. Evs. Evs pala ang tawag niya sa'yo, no? What you're discussing now is very helpful to understand our aging parents as well as our aging neighbor. Salamat, Ma'am Lor, sa TLC program niyo. You're welcome, Imelda. Hope to see you soon,
Imelda,
no?
Kind words.
Kasi nung tawag dito, nung nandun pa ako sa election, we usually talk. So, sinong nanalo? Nananalo si Angeli, Doc, Attitude. From tech ng election. Yung kapamangkin ko po, siya ang ating tech natin. Thank you. So, may nanalo na. So, 3. So, next, libro na lang natin siguro sa susunod sana Sabado, Doc, no? So, anybody, no, Luzon, Visayas, Mindanao can win the book of Doctora. This is very beautiful. So, before we will end, Doc, what about your book, Doc, so that they will be informed? So you said it's volume 1. So may volume 2, may volume 3 pa.
It was printed about March of last year. So in other words, inabutan siya ng pandemic. And it was also about the time where I actually have a few copies left na lang mga
Oo.
siguro 30 something. But,
Mhm.
ang sa akin is, I would have had the volume 2 printed. And my husband, who's also my proofreader and editor, told me that, oh, you know what, this is funnier. Your volume 2 is even funnier. Pero I told him na I don't think it will sell because people are not so into buying these things. No, they'd rather
Yeah.
buy food. So
Mm.
I'll just have a good timing for that. Lagi ko namang inaasa na lang in his perfect time. You know the
Yeah.
cover of that book? Ayan o, yung nasa likod ko. That's
Oo.
yung parang Tres Hermanas ang title. It's nakita niyo
Hmm.
ba? It's the painting.
Yes. Yeah.
Ayan.
Yan.
You know, the
Very
one who
clear, Doc.
painted that, is Reynard Barillo. And, he's being collected by people like Mig Subiri. So, he had a lot of shows he's a big name in Singapore. He's always sold out. So that would have been the cover of my second book. Because the first one, next time na lang natin mapakita, the first one was a
Oo.
cover of, done of, the cover, the title of the, painting was Cuentos. And it was painted by Celeste Lecaro. She's a female artist from Quezon City.
Mm.
So, ano yung laman ng book? It's actually a lot of vignettes or little stories about my encounters with patients with Alzheimer's disease. So
Oo.
actually, some of them are funny and hilarious in a way na even the family members themselves could laugh at
Yeah.
it.
I love to
Lagi
have
ko na,
one, Doc, ha.
sure, tanong ka
Punta
sa
ako niya sa clinic.
libre autograph.
Kaya sige, sige, wow.
Oo. So, it's just
Oo.
vignettes. And the part 2 is also vignettes. Yun lang,
Mm.
volume 2. And I was already working on volume 3 and I'm looking for someone who's gonna do the book cover. So, laging babae na, yung, period, subject. So, sige lang,
Ganda.
siguro pagkatapos ng
Sige.
pandemya. Mm-mm.
So you listen, yung gusto ninyong i-replay kasi the books of Doctora will be our prizes for next Saturday. So ang mga questions for next Saturday, ang mga questions namin for next Saturday is the episode tonight po. So Doctora, it's 9:52. So your parting words to our viewers. Thank you very much. No, we do have a lot of viewers this evening. So thank you very
Oh, we
much
do.
for your one.
Thank
Yeah,
you.
okay, sige. So
Lord,
Doc, parting word. Yes,
parting
Doc.
words. Okay,
Hmm.
wag ho nating hiwalayin yung topics ng first episode kasi may kinalaman po siya sa episode na to. Like if we don't prepare ourselves and we don't have that vision of aging gracefully, we are going to have all these degenerative diseases which we can actually avoid. Well, you can always argue na, can you fight aging? Is there an aging eraser? I'd say no, but it doesn't have to be painful if you're not overweight or obese, diba? Or it doesn't have to be painful for the family if you have Alzheimer's or dementia na para bang isip bata or nagkakaroon ng behavioral problem or to the extent where they can even say na she's no longer the mom I used to know. Di ba
Yeah.
masakit din yun? So we don't want that. And in the third installment of this one, I already have one lined up now. So yung geriatric syndromes. So kung ito, degenerative diseases, a lot of them start with the letter D. The next episode will have letter I naman, geriatric syndromes. Andun yung incontinence, immobility, a lot of other things. So surprise na lang kasi baka i-google niya at marami kayong tanong.
Marami silang tanong.
Oo. Pero
Okay.
actually, gusto ko yung maraming tanong. Oo.
Yeah, yeah.
Na,
So may yeah.
kasi
we
marami
are
kami
looking we are looking forward na may regular show si Doktora dito sa Talk Live channel. So that
may oras
parang
pa
may
ba ako? Dagdagan
yes,
sana ako ni
yes.
Lord ng 20, gawin niyang 25 hours
Because
yung buhay ko, ano?
this is really what we need now, Doc, no? Kasi tawag nito, minsan nga hindi kami makakapunta sa doktor. At least may mga and we're very kasi ako din no, I'm going mag-almost 60 na din. So 6 years to go. So at least no, I'm really happy that you said yes to our invitation, and may mga informations akong natatanggap and mga ano din, mga inputs na dapat kong gagawin. So, thank you
Thank
very
you.
much also, God. So, see you all
Magte-thank you
next.
ako
Oh,
sa aking
yeah,
mga,
thank you.
hindi
Sige.
pwedeng bumati.
So,
As
sure.
always, Dr. Hector Bobby Nazareno of Patterson Plastic Surgery, MDMRC Doc, thank you so much. And to my high school BFF in Canada, Christine Iriarte. Tin, I know, pagising mo pa ito mapanood, but you're in my mind, you're on my mind. And then to my former student, Jack, um, nagturo ako sa nursing school nung nauso yung nursing. So now he's one of the more I'd say successful among my nursing students na talaga nag-pursue ng second course. So Jack Pacaldo, he's now in Nassau in Bahamas. So
Wow.
he actually watched the replay. So I hope that I promised him, okay, next time I'm gonna greet you. So,
Wow.
baka ano siya ngayon, I think nag-fishing siya because it's a weekend.
So
Sarap ng
for
buhay
those,
nila doon.
yeah. So for those of you who are watching, no, you invite your friends, especially for those of you who have mothers and fathers and mga lola at lolo sa bahay. So listen to us on Saturday. That
On the
would be
23rd.
yeah, the 23rd of this month. So parang ano talaga yan siya. Uh, we are very much blessed na si Doktora ay nandito sa aming celebration of 1 year sa Talk Live Channel. So, good evening everyone and see you all. Thank you, Doc. See you next
Thank you.
Saturday.
Thank you everyone
Uh,
who watched.
and
And yeah,
thank you very much and
thank
see
you
you
Laura for
all
having
next
me.
Saturday. Good night everyone and a blessed weekend po.
Maika, matulog ka na.
Yeah, sige. Good night.
Bye, good night.
Hearts that listen. Sama-sama sa TLC.
Hello mga ka-TLC!
I am Ace Perez.
And I am Attorney Migs Nograles.
Please watch Ask Attorney Migs. It's an online show that talks about our everyday legal concerns.
Yes, and you can like our page and you can ask questions and we talk about your everyday situation. So we have cases to answer, mga PM nyo. We try to answer them. So get ready.
Every Monday sa TLC, 6:30 p.m., Ask Attorney Migs.
Dito lang sa TLC. So let us get ready for
Bagong adlaw,
Bagong Hisgutanang Legal.